In guided tissue regeneration, which of the following cell populations is the main progenitor for a new connective tissue attachment? A. Gingival fibroblasts. B. Periodontal ligament fibroblasts. C. Cell rests of Malassez. D. Alveolar bone stem cells. A 39-year-old man with severe anxiety goes to the dentist for treatment. His doctor has suggested medicine to help him control his generalized anxiety problem in the long run. Which of the following medicines has his doctor most likely given him? A. Fluoxetine. B. Diazepam. C. Clozapine. D. Amitriptyline. When you work in dental public health, you are asked to help plan a study to find out what benefits fluoridating the water supply has for the people in the area. Which of the following research designs, if any, is the most appropriate? A. Cohort study. B. Cross-sectional study. C. Randomized controlled trial. D. Case control study. A lady, 53, has been identified as having burning mouth syndrome. In this condition, what area of the mouth is most usually affected? A. Lips. B. Hard palate. C. Tongue. D. Soft palate. You are creating an occlusal rest seat on the left first premolar of the mandible for a partial cobalt chrome denture. Which of the following best defines the ideal depth at which the marginal ridge should be decreased? A. 2.0 mm. B. 1.5 mm. C. 0.5 mm. D. 1.0 mm. A 25-year-old man is attacked. He has a fracture of the left zygomatic arch and will need surgery. Which of the following muscles is attached to the superior edge of the zygomatic bones arch? A. Masseter. B. Medial pterygoid. C. Temporalis. D. Lateral pterygoid. Which base or liner could hinder a resin composite restoration from polymerizing? A. Copolymer. B. Calcium hydroxide. C. Zinc oxide eugenol. D. Glass ionomer. Which sort of study gives the strongest evidence for making judgments about patient treatment? A. Systematic review. B. Evidence summary. C. Cohort. D. Case control. OSHA's bloodborne pathogen standard mandates healthcare. Except for one, employers must perform all of the following. Which is it? What is the exception? A. Make hepatitis C vaccinations available. B. Provide personal protective equipment. C. Implement the use of standard precautions. D. Establish an exposure control plan. Which of the following screening radiographs would be most useful in determining a fracture of the mandible? Panoramic, bite wing, periapical, bite wing. After a 40-pack-year smoking history, a patient expresses a wish to quit. Except for one, all of the following would be proper actions. Which of these is an exception? A. Recommend hypnosis. B. Prescribe a nicotine, Nicoderm CQ, patch. C. Recommend use of a smokeless tobacco. D. Recommend nicotine, Nicorette, chewing gum. Which of the following should you do before taking out tooth 24? A. Warfarin, Coumadin, should be discontinued the morning before procedure. B. Clarithromycin, Biaxin, 500 mg should be taken 30 minutes to 60 minutes before procedure. C. No antibiotic administration is required. D. Amoxicillin 2 grams should be taken 30 minutes to 60 minutes before procedure. Reimplantation is preferred. After avulsion, how can permanent teeth be effectively shielded? A. Wrap in a wet napkin. B. Put in a cup of milk. C. Place back into the sockets. D. Place under the tongue. How many crystalloid infusions are necessary for 100 cubic centimeters of blood loss? A. 300 cc. B. 400 cc. C. 100 cubic centimeters. D. 200 cc. Which local anesthetic produces cutaneous vasoconstriction? A. Prilocaine. B. None. C. Procaine. D. Ropivacaine. What is the color code for a medium-level emergency patient? A. Black. B. Yellow. C. None. D. Red. Mandibular nerve block using a closed mouth technique? A. Akinosi method. B. Gao-Gates technique. C. None. D. Both. Muscle that has been penetrated in IANB? All. Medial pterygoid. Buccinator. Temporalis. Which of the following ASA classifications applies to a patient who's under threat to life? A. 5. B. 1. C. 3. D. 4. The needle is moved toward the condyle's neck in? A. Akinosi method. B. Inferior alveolar block. C. All. D. Gauge-Gates technique. Doctor of Dental Surgery degree. When you go to the dentist, you might see a DDS or a DMD next to their name. Despite these differences, they both have the same education and training. The difference is simply a matter of tradition. When Harvard added a dental school in 1867, they had a tradition of using Latin for their degrees and needed to find an appropriate name for the new degree. In addition to providing general dental care, dentists can perform cosmetic procedures and prescribe medications for their patients. They also help monitor the oral development of children and make referrals to specialists such as orthodontists when necessary. As a result, dentists have many duties, which makes their career one of the most rewarding jobs in healthcare.